We take on the hardest part of actually running a pharmacy. mPharma is responsible for sourcing, procuring, financing, and managing the distribution of the product onto the shelf space of a partner pharmacy. So pretty much before mPharma, a pharmacy not only has to provide clinical services to their patients, they also have to wake up every day and figure out where are we going to buy these products and how do we secure the financing to actually purchase these products. Once they join mPharma's network, they only focus on the clinical aspect of their work. Get patients in, provide the best medical advice, and mPharma is responsible for getting the product onto the shelf space. And we do that by using technology to, one, collect data from partner pharmacies to understand their own consumption patterns, and that data tells us exactly how much to stock, when to stock, and which days to bring these products. And once we do that, we also have to bring the financing into the mix so that they don't need to worry about working with banks where they have to get high interest rate loans, which obviously goes back into the cost of the product that they sell to the patient, because now they can only focus on selling and dispensing to patients. Governments in the public sector have been wholly inadequate in actually managing the drug supply chain, which means that more and more people are forced into the private sector to get their medications. Well, when people are forced into the private sector to get their medications, there's also a lack of government regulations. So most African countries are what we call a free pricing market, where governments do not set drug prices. So you can walk into two pharmacies next to each other, and the cost of a drug for the same drug will be widely different, right? So I would say a failure of governments, but also a failure of the commercial structures that would enable the private sector to actually guarantee drug availability.